Hi, I'm Liz. I'm going to go over your pre-op information for your upcoming surgery with Dr. Thawrani. We have several things to cover, so I'll just go over everything. And if you have questions, please call the office 513-791-5200 or send a MyChart message. The first thing I want to do is show you, we have two books. We have the hip book and the knee book. If you're having a hip surgery or a knee surgery, these are the books that you will have. And there's also inside the book, the packet, which I will go over with you. So starting from here, whether you're having a hip or a knee surgery, the surgery coordinator will be calling you to give you your surgery date. Give her a couple of days to reach out. Once you get your surgery date, you can write it right here. And then you need to hang up the phone, call your primary care, and get your surgery, your history and physical scheduled with your primary care physician within 30 days of that surgery date, not 31. And I will go over that. This is your history and physical form. They will need to fax it to both numbers. And this is going to be with Dr. Thawrani. And it needs to be completed within 30 days of your surgery date. Again, once you get your surgery date, you call your primary care, say I need my history and physical completed within 30 days of my surgery date, and then you bring this in with you, whether it's a Christ doctor or not. The next thing is the surgery checklist. There's a lot of information on here, but I'm just going to hit a few points. Right here, Dr. Thawrani, if you need dental clearance, we need you to get dental clearance from your dentist just to show that you do not have any active infection. If you need cardiac clearance, we need cardiac clearance from your cardiologist and a recent EKG. That can be within 6 months of your surgery date. If you have any other specialists, like a rheumatologist, endocrinologist, nephrologist, any type of specialist, pulmonologist, please get clearance from them as well. Dr. Thawrani requires all of his patients to get a cold therapy unit. This cold therapy unit is extremely important for your outcome. And I will go over this. This is your cold therapy unit. You're going to purchase this one. It is $200. Insurance will not cover this. This is not something insurance will cover, so you have to pay out of pocket. You can call Jerry or Jesse at Breg, and they can set up a payment plan if you cannot pay for it all at once. They will take 25% down and set up a payment plan. The reason why Dr. Thawrani requires all of his total joint replacements to have a cold therapy unit is so that we have continuous cold therapy on that joint for 24/7 for the first 2 weeks. This is not something that you're going to carry around. You will just set it down wherever you're sitting or when you're going to bed. You're going to unplug it to turn it off, and then you're just going to disconnect it from here. If you're having a knee replacement, you leave that knee pad on your knee. The only time you take it off is when you take a shower or when you go to physical therapy. If you're having a hip replacement, you're going to wear it on the hip. The only time you take it off is when you are taking a shower, going to the bathroom, or going to physical therapy. If you have any questions regarding the cold therapy unit, please reach out to Jerry or Jesse at Breg, and they will be happy to go over any instructions that you need, and they can also come out to your house and show you how to use it. This is vital for your outcome. It reduces swelling, which reduces your pain, which reduces your narcotic use. And this is a required product that Dr. Thawrani wants all of his total joints to get. If you have any questions, please call the office, 513-791-5200, or send a MyChart message, and we'll be happy to answer any other questions. Back to the surgery checklist. Pre-admission testing will be calling you to get you scheduled for your labs, a nasal swab to check for staph and MRSA, also draw some blood, and get a urine collection. If they do not call you within 14 days of your surgery date, please reach out to them and have them get you scheduled. Also, physical therapy will be calling you for one physical therapy pre-op visit at a Christ facility. They will go over your pre-op and post-op exercises, post-op expectations, and get you a walker. If you already have a walker, please bring that walker with you so that they can check it, make sure it's in good working order, and it is the right size for you. Also, we only give 1 week's supply of pain medication at a time. So please give us 24 to 48 hours notice before you need a refill. All the other medications that Dr. Thawrani prescribes post-op will be a 30-day supply, other than the antibiotic, which is only 7 days. Once you complete the antibiotic, you do not have to complete it again. Next, we have your discharge planning information. You can just read through this. If you have any questions, let us know. CareSense, which you will be signed up for. This will give you reminders prior to your surgery on things that you need to do. It will also give you reminders after your surgery on things you need to do, like using the cold therapy unit, doing the incentive spirometer, getting up and moving around. This will go over a lot of things, and it sends those reminders to you. If you have any questions about this, again, let us know. The last thing in the packet is the pharmacy genetic testing. They will reach out to you and ask you anything or answer any questions you have regarding the genetic testing. This is not required. This is something that Christ Hospital offers from the pharmacy. But you can read through this, and then one of the pharmacists will reach out to you prior to your surgery. Now, I've gone over everything that is in the booklet for both the hip and the knee. And this is your knee book or your hip book. This is your table of contents. I would like you to read it twice. Please make any notes that you need, any notations, dog ear, whatever you have to do. This is your book. I have a few more things to cover. If you are having a total knee replacement or a knee revision, you will be given a knee sleeve. This goes mid-thigh down to the calf, and you're going to wear this 24/7 for the first 2 weeks after your surgery. The only time you take this off is whenever you shower. You can even wear this to physical therapy after the 2 weeks because it just gives some gentle compression. You will not be wearing compression stockings or TED hose. You will be wearing this on the operative leg only. And then you will put the cold therapy unit pad on top of this, so it will go on your knee. It will go over your bandage, mid-thigh, down to the calf, and then you put the cold therapy pad on top. Always have something between your skin and the cold therapy pad. Otherwise, you will burn your skin. And again, you can wear this after the 2 weeks, anytime you like, including at physical therapy. It just gives gentle compression. For the hips, for men, we would like you to purchase compression shorts, bike shorts, anything that gives gentle compression, high waist to mid-thigh. For women, yoga shorts or yoga pants, again, gentle compression, high-waisted to mid-thigh, or you can do the full leg, whichever you prefer. The compression on the hips are important because it keeps everything compressed and kind of gives you a feeling of security. And also it gives you that barrier between the hip pad for the cold therapy unit and your skin. So you will wear, whether male or female, you will wear this 24/7, other than when you're taking a shower. And you can also wear them to physical therapy. The last thing I have is the incentive spirometer. If you've never used one of these before, I'm going to demonstrate. This helps with your respiratory system. It helps to prevent blood clots. It helps with your circulatory system. And it also helps feed those red blood cells the oxygen it needs in order to help heal. And it gives you a better outcome. And it also keeps your fever down. So you're just going to put this on. You will receive one in the office. You push this on here, pull this out, and then you're just gonna gently suck in until you can no longer suck in. You hold it for about 3 to 5 seconds, and then just gently let the air out. And you're just going to do it like this. Nice and gentle. You're going to be doing this 10 times every hour, not 10 times a day, 10 times every hour while you're awake after your surgery. Dr. Thawrani will also ask you morning of surgery, how many times do you have to do the incentive spirometer? 10 times every hour after your surgery. And you can even start this prior to your surgery just to get used to using it so that you can grab it and you're already used to using it. Dr. Thawrani will ask you 3 things morning of surgery. How many times do you use the incentive spirometer? 10 times every hour. The second thing, increase your water intake by 24 ounces if you're a good water drinker. If you're not, you need to drink at least 1 liter of water per day after your surgery. The third thing, increase your fiber. To increase your fiber, you can use the fiber pills, fiber powder, you can use food, whatever you choose, but because of all of the post-op medication, it will cause constipation. So using the incentive spirometer helps your circulatory system, increasing your water, helps your renal system, your kidneys functioning better, and it also feeds more hydration to your bowels, and increasing your fiber will help continue to keep your bowels moving. There is a bowel regimen in your discharge paperwork just in case you get backed up. Just make sure you have a stool softener that you're taking daily, and you have laxatives at home just in case you need it. I've covered everything. If you have any questions, please give us a call at 513-791-5200, or you can send a MyChart message. Thank you and have a good day.